Hello everyone, welcome back to our channel today. I'm going to talk about ovarian cancer, a type of cancer that originates in the ovaries. Ovaries are part of female reproductive organs responsible for producing eggs and hormones like estrogen and progesterone. Ovarian cancer are often referred to as the silent killer because its symptoms are vague and tend to be overlooked or mistaken for other conditions until the cancer has reached an advanced stage. In this video, we'll cover what ovarian cancer is, its risk factors, symptoms, methods of diagnosis, treatment options, and strategies for prevention of ovarian cancer. Let's begin by understanding what is ovarian cancer. So, ovarian cancer refer to cancer that starts in the ovaries. While there are different types of ovarian cancer, the most common form of ovarian cancer is epithelial ovarian cancer, which begins in the thin layer of a tissue that covers the ovaries. There are also other types, such as germ cell tumors, which start in the cells that produce eggs, and stromal tumors, which develop in the tissues that holds the ovary together. The ovaries are vital components of the female reproductive system, but because they are located deep within the abdomen, it can be difficult to detect cancer in its early stages. Ovarian cancer typically progresses quietly and may go unnoticed until it spreads beyond the ovaries. So, the risk factors for ovarian cancers which can cause the cancer in the ovaries are exactly unknown. While the exact cause of ovarian cancer is not fully understood, several factors can increase the likelihood of developing the diseases. Risk factors include like age. Ovarian cancer is most commonly diagnosed in women over the age of 50, particularly those who have gone through menopause. The risk as women age, with majority of cases occurring after age 50. Family history and genetics of ovarian cancer especially involves close relatives like mother, sister, and can significantly increase a person's risk of getting the ovarian cancer. Certain inherited gene mutations, such as those in the BRCA1, like BRCA2 genes, are also linked to breast cancer, can greatly elevate the risk of ovarian cancers. Other genes, like Lynch syndrome genes, are also associated with high risk of getting ovarian cancer. If there is any personal history of breast cancer, women having a history of any breast cancer have increased risk of developing ovarian cancer. This is particularly true if they have mutations in the BRCA genes. Hormonal factors like number of times a woman ovulates in her lifetime may influence her risk of getting the disease. Women who start menstruating early, go through menopause late, or who never had children may have slightly higher risk of getting the disease. Hormone replacement therapy during menopause may also raise the risk in some women, although this is still debated in research with women endometriosis conditions where tissues similar to the uterine lining grows outside the uterus have a high risk of developing ovarian cancer. The exact connection between endometriosis and ovarian cancer is not fully understood, but inflammation and hormonal changes related to endometriosis may contribute to the development of cancer. Obesity has been linked to an increased risk of various cancer including ovarian cancer. Excessive fat may produce additional estrogen which can promote the growing of hormone sensitive ovarian cancer cells. Lifestyle factor like smoking, poor diet, and lack of physical activity may contribute to an increased risk of ovarian cancer. Although these factors have a more indirect role compared to genetic and hormonal factors, symptoms of ovarian cancer are often subtle, which is why it is called a silent killer. Many of the signs can mimic those of less serious conditions. Some of the most and very common symptoms include like abdominal bloating or swelling in pelvic region or abdominal pain, difficulty in eating or feeling full quickly, frequent urination, fatigued indigestion, or heartburn changes. Heartburn is very common. Changes in bowel habits, constipation, or diarrhea. Unexplained weight loss or weight gain, because these symptoms are vague and can be attributed to a variety of other conditions such as irritable bowel syndrome, menstruation, or menopause. They are often overlooked, which leads to late stage diagnosis in many cases. Diagnosing ovarian cancer can be challenging due to lack of clear and specific symptoms. However, there are several approaches that a doctor or a healthcare providers use to diagnose or rule out ovarian cancer. The foremost important is pelvic examination done by a gynecologist. During pelvic examination, we doctors feel for an abnormal masses in the ovaries or other areas of the pelvis. While this can sometimes detect large tumors, it may be not effective in detecting early stage ovarian cancers. We do advise some imaging tests like ultrasound. Ultrasound uses sound waves to create an image of ovary and can help identify cysts or masses in the ovaries. Not all ovarian tumors will be visible on ultrasound. In some cases, CT scan or MRI are required to provide more detailed pictures of the abdomen and pelvis that helps doctors to assess the size and spread of any tumors. Coming to the blood test required in diagnosing ovarian cancer is CA-125, which measures the level of protein that often elevated in ovarian cancer patients. CA-125 is not specific to ovarian cancer. It may also be elevated in conditions like endometriosis, fibroids, or pelvic inflammatory diseases. Therefore, it is not used as a screening tool for the general population. Genetic testing. If ovarian cancer is suspected, genetic testing may be recommended, especially for individuals with a family history of the disease. Testing for mutations in the BRCA1 and BRCA2 genes as well as other inherited cancer syndromes may help guide treatment decisions and often insight to the patient's family's risk. Coming to the treatment of ovarian cancer. Treatment of ovarian cancer involves a combination of surgery, therapy. Treatment of ovarian cancer involves a combination of surgery, chemotherapy, and sometimes targeted therapy. The treatment plans depends on the stage of cancer, the patient's health, and other individual factors. The primary treatment of ovarian cancer is surgical removal of the tumor. The goal is to remove as much of the tumor as possible. In early stages cancer, this might involve removing only affected ovary. In more advanced stages, the surgeon may need to remove both ovaries, the fallopian tubes, and the uterus, and any affected lymph nodes or tissues. Debulking surgery may also be done for the advanced cancers, which involves removing as much as of the tumor as possible, even if it is not completely resectable. Chemotherapy. After surgery, most patients with ovarian cancer will undergo chemotherapy. Are the drugs that target rapidly dividing cells, including cancer. Common chemotherapy drugs for ovarian cancer include carboplatin and paclitaxel. Chemotherapy can be administered intravenously or directly into the abdomen, that is called intraperitoneal chemotherapy, for more effective delivery to the site of the cancer. Some advanced treatment options are targeted therapy and immunotherapy. Targeted therapy uses drugs that are specifically targeting cancer cells without harming normal cells. Prognosis and survival of ovarian cancer patients largely depends on the stages at which it is diagnosed. If diagnosed in early stage, the cancer is confined to the ovary, the survival rate is much higher. However, because ovarian cancer is often diagnosed as at a later stage, the survival rate for advanced ovarian cancer is very low. What is the prevention of ovarian cancer? There is no sure way to prevent ovarian cancer, but there are several strategies that we advise and that reduces the risk. Like oral contraceptive pills uses has been shown to reduce the risk of ovarian cancer, possibly by preventing ovulation. Childbearing and breastfeeding, having children, and feeding your kids lower the risk, as these factors reduces the number of ovulations a woman experiences. genetic counseling and testings for those with a family history of ovarian cancer known with BRCA mutations, or genetic counseling can help to assess the risk and guide decisions regarding prevention of ovarian cancer. The last is for most important is healthy lifestyle. That is very important in preventing ovarian cancer. Thanks for watching our videos, and for more such information kindly like, share and subscribe to our channel. And for any questions or any query, please call us on given phone numbers or messages in the comments below. Thank you.